It's one thing to say, well, we'll cut this tumour out of your breast, that's fine, but where else is it, is the question which is really was really playing on my mind very much.
In Australia, 53 people will be diagnosed with breast cancer every day. But between March and May of this year, under the first wave of COVID, breast cancer diagnosis decreased by nearly 40%. That's because women who were wary of getting the virus just weren't going into the clinics to get their regular screenings. But for Helen Parry, who's the Chief Imaging Technologist at the Royal Perth Hospital in Australia, and whom I'm about to talk to remotely, her diagnosis came about because the inflow of women had actually dried up.
Helen, this particular mammogram that you had, it wasn't a routine check, was it? So why were you actually doing it?
At the hospital, we installed a new piece of equipment. However, we installed the unit in March of 2020, which is a bit of a flag for what happened in March of 2020, and that, of course, was COVID. So the screening program in Western Australia was ceased. So we were left with a beautiful, shiny new mammogram unit, and we had no patients to refine our skills on. So knowing that I was due for my mammogram 6 months later, I happily volunteered to be one of their first patients. Walked in, had it done. Seemed quite straightforward, walked back to my office and never thought a thing about it.
Cast your mind back to that moment where one of your colleagues pulls you into the office, sits you down and says, Helen, you've got breast cancer. What was the first thought that went through your head?
I needed to forget that I was the chief radiographer and then become the patient. And I had every confidence that I was in the best hands possible. The radiologists that do the reporting, they do a double read. So they have a series of completely independent doctors that look at the images to make sure that there's just a strong crossover of opinion. And the first doctor that saw it thought it was normal. And then the second doctor that looked at it a day or so later was a bit concerned. They got a third doctor to have a look at it. And 2 out of the 3 thought it looked abnormal, so they called me back.
What are the next steps?
Okay, so I had the biopsy on the day, then I met with a breast physician. Your prognosis is tied up with what type of cancer that is. So we knew it wasn't great, we just didn't know how bad it was. That took about another week to get that back, which was probably the longest week of my life. Obviously, surgery was the only option. But at that point, we didn't quite know what type of surgery. And then we need to know that if it had spread at all, and that's another question.
Walking into that conversation with the specialist that is going to have that dialogue with you, was that the most fearful part of the journey so far?
I think it was because I really didn't know that at all. And it's one thing to say, well, we'll cut this tumour out of your breast, that's fine, but where else is it, is the question which is really was really playing on my mind very much. So getting that, I think I actually started crying actually in the surgery because it was such a relief. I felt so well after the surgery and everything was very good, no problems with scars and wounds and all that business. But this was still playing on my mind, and chemotherapy, and you can see I've got long hair, so the first thing I thought was I'm going to lose my hair. Save me a lot of money, but I was going to lose my hair. How's all this going to go? You know, how's it going to go with work and family and all that? You know, your life is on hold definitely till you get that understanding that how things are going to progress over the next 6 months.
What would you say to a woman that was planning to skip a mammogram or wasn't planning to come in for a mammogram if she's in that stage of her life where she needs one every 2 years?
We live our lives around deciding on risk, whether we put a seatbelt on when we get in the car, You know, it's all about risk management. And given that this is readily available, it's slightly uncomfortable, but I mean, women, just about any test a woman has is uncomfortable. So it is uncomfortable, but to me, it's a complete no-brainer. And as I said, because the outcomes are so good with early detection, they are excellent, that why would you not?
Helen, thanks for chatting with me today.
It's been great. Thanks, Michael.